I know, Miss Sylvia, that we've talked both about difficulties that we've had in getting treatment, finding doctors that even have knowledge about our cancer.
Right.
Would you like to share any of the challenges that you've gotten in particular with just seeking treatment?
Oh, goodness, yes. To seek treatment is very vital, first of all, that we find a specialist in our disease. I mean, I'm sure you've experienced that. And I always said I have too many ologists,
Right.
I wish I could get rid of some, but,
Right.
And I have a few less ologists now that I found the right doctors.
Right.
I feel that way. And it's just been a long journey getting there because, I mean, some doctors I found were honest and they would just say, I don't know, or, I don't know where to send you, or I'm not sure of this or that. But yet when we go there, they know what to do with us, and I feel comfort in that.
I know myself personally, patient advocacy, being able to advocate for yourself has been a huge gift that I've learned to do for myself.
Right.
Because so many times the doctors would say, oh, well, we're going to put this stent in you, or we're going to try this different injection in you. And it took me actually having to stand up for myself and say, I've read up a little bit, and I don't think that that's the best way to go about it. I see that, this stent can cause occlusion and I could have problems.
And in your way, it seems like you had the shorter journey to diagnosis. Like you said, you only felt sick for a few weeks.
Right.
But look how amazing your story is from that point on. As compared to mine is the longer journey.
Right.
The more common of the rare.
Right.
Except I'm wondering one day, is it really so rare? Because I think it's just maybe not enough education in the medical community.
Well, and what I've actually found is that it's not just, okay, well, I have neuroendocrine pancreatic cancer, and you might have neuroendocrine small bowel.
Right.
Well, they have neuroendocrine intestinal cancer and in that gut area, but you can get it in all over your body.
Right.
But there's more and more cases that are being discovered and found.
Every day.
So it seems to me as a patient, it's like, oh, well, you have pancreatic cancer. Unless you know that there's different kinds and you ask that person, well, which kind of pancreatic cancer or which kind of intestinal cancer or small bowel, unless they know that, then you're not really getting the help you need. You really have to ask, is there another subsect of that? And is there a specialist of that? And that's what I found.
I did too. It's very important to be in the right place.
Is there anything you wish you had known before all this started that could have helped you dealing with all the stuff that has happened with the cancer?
Yes, because in 1999, I knew nothing. And I didn't see the importance of knowing, what we need to know now to take care of ourselves, just to live, And with the journey being so long, just to find the right person is frustrating. But in 2010, yes, I started with, I had a hysterectomy even, and they went in, and a total hysterectomy. That was only a few months, less than a year. I had that surgery in July of 2010. 2011, I had my big surgery because by then I was stage 4. It was all over my liver, and everywhere in between on my small bowel and everything. So it's frustrating. I wish I had just known to even tell my gynecologist that I had these symptoms.
Right.
He went inside of me. He didn't even know. Guess he wasn't looking for that.
Right.
And I just wish that I had told my symptoms to more doctors. And I did, but maybe not to the right ones or not to all of them. I guess I felt like.
So you feel like there was no communication?
I couldn't fit the puzzle together, to get the doctors to help me fit the puzzle together. I didn't realize things were connected
Right.
so much.
Mm-hmm.
And that's how I felt.
Well, and I completely understand what you say. And I want to kind of say thank you, because you've kind of set the stage ahead of me so that my journey could be shorter. Without people like yourself that are going out and going through all these different scans and getting all these things done to figure out what doesn't and what doesn't work earlier on, I have that ability now to just walk in and have the shorter journey and say, okay, well, this doesn't show up, and okay, this doesn't show up. But if you hadn't gone through that, I wouldn't be able to be sitting here talking to you.
Well, I'm so glad that I could help you in that way.
Yes,
and,
ma'am.
We'll just have to stay educated.
Yes, ma'am.
And what will the years bring? Just more and more good.
Yes, ma'am.
I see that coming.
Mm-hmm.